My name is Ian Horvath, and today we are going to be talking about the genetic disorder called Usher Syndrome. Usher Syndrome was first described in 1858 by Albert von Graef. It is named after Charles Howard Usher, who was a Scottish ophthalmologist. He observed a link between congenital deafness and retinitis pigmentosa in the year of 1914. Usher syndrome is an inherited syndrome that involves both hearing loss and vision loss. The hearing loss may be mild to complete. The vision problem is called retinitis pigmentosa. There are three types of Usher syndrome. A, patient, a patient is classified into one of the three clinical types based on their severity of hearing loss at birth. There are over 100,000 known cases of Usher syndrome all across the world. The deterioration of the eye is called retinitis pigmentosa. There's no cure for the disorder yet, but scientists are working to find one. Usher syndrome affects everyone. It does not target or focus on anyone because it is a gene-inherited disorder. Andrew Neiman is a young boy who was diagnosed with Usher syndrome when he was 2.5 years old. He describes that life is a challenge, but there are always ways to overcome it. A person gets Usher syndrome from their parents. Each parent must have an inherited gene to have given a gene to their child. The other way Usher syndrome is contracted is when a parent's gene mutates or changes. There are 9 possible gene mutations. There are examples of these, such as CDH23, MY07A, PCDH15, USH1C, and USH1G. Someone who has Usher syndrome has defective genes that cause the inner ear to not be formed correctly at birth or is damaged over time. Loss of hearing can happen slowly. There is no specific timeline. Each person is different in how quickly they will lose their hearing. When the Usher syndrome happens, a person loses their vision when the retina slowly begins to deteriorate as the person gets older. The retina is a tissue at the back of the eye that helps you see. The gene mutation from Usher syndrome affects the retina's light-sensing cells called rods and cones. The condition is called retinitis pigmentosa, or RP. In RP, the retina's light-sensing rods and cones slowly go bad, starting at the outer edges. As RP gets worse, the person loses peripheral vision first, then central vision. There is no cure for Usher syndrome yet, but there are treatments and therapy for the disease, such as hearing aids, seeing an optometrist, vision therapy, and electroretinography. All in all, Usher syndrome is a genetic disorder that is found in children from the beginning of their life. There are nine described genes that are found from studying Usher syndrome genetics. It is better if it is found early in the child's life so that it can be medically treated. Main symptoms of the Usher syndrome are hearing loss and vision loss, but both symptoms may be permanent if not treated early. It is also found that if both parents have a gene, they have a 1 in 4 chance of having a child with Usher syndrome. With each pregnancy, and over 100,000 kids have been diagnosed with this Usher syndrome. There's no current cure for the Usher syndrome, except for hearing aids, seeing an ophthalmologist, vision therapy, and electroretinography. This disorder affects many people, but you can help. Do your part, save many other kids from getting Usher syndrome. Thank you for your time.